to be illegal on the basis of illegal authorization. By legal, we mean that an authorized prescription has to be available for any dispensing to start. Authorized, it means that a doctor, a consultant, a surgeon, someone that is authorized to put forward a prescription, having reviewed the case of a patient, must authorize prescription for a pharmacist or a pharmacist technician to dispense. That's number one. What makes it legal is that there's a prescription signed by a professional. Okay, that's the first thing. The second thing of the four, we said it's a technical process. It's not a cut and join. It's not I beg you just hand over the drug. No, it's a technical process, and so it starts from preparation, packaging, compounding. Depending on if it is required, labeling. We went through all of that, and each step is as critical as every step within the chain or within the process. Then the third thing we spoke about is dispensing. It's about understanding the patient's need, and responding. It's patient-centric, right? We want to ensure that the patient understands what they are being given, how to use it, what to look out for, interactions where possible, when to take the drugs. So it's about providing information that would help the patient get better. Because after all, ultimately, why do we all go to a hospital or seek for care, medical care? Is because we want to get better. We want to get better. And lastly, we said dispensing is about safeguarding the patient's safety and ensuring that the therapeutic outcomes are gotten. That is it. If you can't remember anything, please remember these four elements of dispensing. We spoke about why it matters. I wouldn't go much into that. Then we took time to look at a bit of history, how dispensing has evolved over the years. I'm sure you will get these slides once we are done. Then we looked at the dispensing process. We said that there are seven steps, to the dispensing process. It starts by receiving a prescription. You move to screening, you run a clinical check. Once you're done, you want to prepare your drugs. Pick that from the shelf, or go to the safety room. You're just pulling together all your medicines and preparing them, setting them up as they should. We looked at labeling. Then we said this fourth step is you have to run a validity check. Is what you're giving, is it accurate? Is it the right patient? Is it the right drug? And all of that. Then the fifth step is actually issuing out the drug to the patient. We spoke about the sixth step being documentation. And work done, not written, is not done. You have to document for many reasons, for traceability, it's best practice in itself, it's inventory keeping, and for reference. We need to document. Then we spoke about the last step being counseling, right? We all agree that most likely than not, especially when it's an outdoor patient case, like the person just coming to the hospital and is leaving, or going to the pharmacy and is leaving, the pharmacist or the pharmacy technician is likely the last person to see a patient. And so you're the last woman standing, right? So you're supposed to ensure that there are safeguards, and you're supposed to counsel the patient, giving them reassurances of their safety, of the efficacy of the treatment, the medicines, and assurances of getting better before they leave the hospital. So that's what we've done in the last two classes. I hope you have been able to recall based on what I have said. With that, we move on to our conversations for today. So basically, today we're going to look at legal and regulatory frameworks. We'll look at specifically when it comes to Nigeria, what are the agencies, the main agencies that guide our practices as pharmacists, and technicians, would again go through what a technician role is. It's important that as a technician, you understand your role as it relates to the dispensing process. We look at some common errors, right? We're all humans. We are subject to make mistakes. And so some commonly found errors around the practice and what we should do, or how we should learn to avoid such errors. And then I think we'll summarize for this particular model. So we'll just go right into it for today. Please, can we look at slide 32, legal and regulatory framework? So, I was privileged to listen to the lectures on compounding yesterday, and the our instructor spoke, took a time out, took a while to talk about pharmacopoeia, and how that is a standard for compounding reference points, all of that. Like basically, he said the Bible and the Quran. I remember that of dispensing, of compounding. So likewise, the dispensing process, and even as a pharmacist or a pharmacist technicians, there are frameworks. Framework means there are things that you should do, there are guiding principles, kind of provide boundaries, don't exceed these, don't do that. If you go outside these, it becomes illegal. And once it's illegal, it could become a criminal of a case or offense. So most of the framework, and legal provisions that guide dispensing looks at basically four core things, right? So either if it is through NAFDAC or it's through PCN, or even if you go to the US or UK or Dubai, all the legal and regulatory frameworks that guide dispensing looks at these four core things, right? The first one is there must be a valid prescription. Like I've said this, I'm sure if you had to count the number of times I've said valid prescription on this call, it's more than 10 now. That's because it is important. Like that is the beginning of a right or wrong process. It has to be valid. It has to have a name. It has to be signed by a doctor. It has to carry a date. It has to carry the drug, all of those things that we spoke about within a valid prescription. No valid prescription, no dispensing. Do not dispense, literally. I know that, well, nowadays there are a lot of over-the-counter drugs. People just go in and give me Panadol, and you're given. But the practice, right? The practice stipulates we do not give drugs without a prescription. That is the law, right? According to dispensing. Now, the second framework or guide, right, is that the confidentiality of the patient is important. Is important because depending on the kind of drug that you're issuing, generally, confidentiality should be key. You do not move around, you do not discuss patient cases. In your house, that other day, Mr. Yakubu came to my office, came to the pharmacy. Do you know he has this? No, no, no. Confidentiality is confidentiality. You do not disclose, information. You do not disclose details about patients, or what kind of drugs that they are given or otherwise. Is very important. There are exceptions in rare cases where there is a legal or a case, an investigation. And with that, I know that there are due processes, if the law, expects you to disclose, those are exceptions. But on a regular, please, it is not ideal at all as a pharmacist or a technician to disclose patient information. Confidentiality is important. There are controlled substances, strict rules. Somebody mentioned codeine, yeah, tramadol, there are drugs, diazepam, there are drugs that are a bit controlled. And so, even for those, there are guidelines on how to handle them. And lastly, as a technician, you have to learn to record. Like, you must learn to record so no matter the country you find yourself, um, these are frameworks that you would have to adhere to. So let's go to the next slide and look a bit closely as at please, next slide. Let's look at more closely some of the agencies that guide and provide oversights, specifically as it relates to pharmacy practice, dispensing inclusive. So you know that we have global standards, and basically, either in the US or UK, they over time, they provide frameworks and standards, global standards, which countries adhere to. But here in Nigeria, there are two main agencies, basically, that support either the practice or the framework on processes of pharmacy and pharmaceuticals. If you're in Nigeria, pharmacist or not, if you've never heard of NAFDAC, then you're not a Nigerian. I'm sure even those in the villages, you must have heard NAFDAC. You must have heard PCN, Pharmaceutical Council of Nigeria. NAFDAC stands for National Agency for National Agency for Food and Drug Administration and Control. Okay, that's the meaning. Now they are two different agencies. They have two different mandates, and they bring two different expertise to the table, right, when it comes to pharmaceuticals. I would advise after this class, once you have your spare time, to take time and go through their websites. There are a lot of things that you would learn. But for the sake of this class, we'll look at basically five dimensions, five things that separates the two of them. Again, it's for our learning and for our reference. So PCN, right? Pharmaceutical Council of Nigeria. What they are skewed towards is the practice of pharmacy. That is anything that has to do with practice, training, vendors, the practice itself, that's what PCN regulates. Okay. NAFDAC, on the other hand, what they do is they regulate and control issues surrounding manufacturing, importation, exportation. I mean, if you have a drug, there's no NAFDAC number, or even any product that has, medicines or chemical products or allied products, there's always a quest for NAFDAC number. That's because it provides standards and provides reassurances that, these products would have gone through certification, would have gone through quality checks. And so anything that has to do with manufacture of drugs, either you're importing, you're exporting, you're distributing, advertising, or sales, not just drug, including food, cosmetics, anything along, the how do you call it, the downstream of things. NAFDAC, right, is in control of that. So that's what separates them from PCN. That's the first difference. Now, the second difference is that PCN basically focus on the human being, the human resource and professional standards. So as a pharmacist or as a technician, you finish school, you will have to be registered, you have to be renewing licenses. I think that one is with PSN, but basically PCN is looking at the human being and the profession, making sure there is ethical adherence to the practice, and you've gone to school and all of that, like the training that you're doing right now. PCN, would have been informed, and they would have authorized this training to have happened. They gave standard. This is how the curriculum should be. So that is PCN. Okay. Now NAFDAC, on the other hand, their own is safety. This drug, is it safe? This drug, is it the right quality? This food, does it have any how do you call it, any side effects? Will it cause harm to the patient? So basically, they are looking at consumables, they're looking at the therapeutics, of the food and the drug. Okay, that's number two. Number three, they're established by different laws. So if you go to their website, you see that NAFDAC is established under a separate act from PCN. So that makes them very distinct. Then in terms of scope of how they operate, PCN, they're the ones that used to pursue all the pharmacy stores, education, internship, professional development. PCN deals with that, while NAFDAC is interested in the products, anything products. That's the scope of NAFDAC. Then lastly, PCN, what they do is, like I said, they're looking at the human being and the practice, and so they want to make sure that all that we do is professional. There's ethical standards that are being upheld, and there's quality in the delivery of the care, either in the chemist, in the pharmacy, or in the hospitals. Okay. Then for NAFDAC, basically, they want to make sure that as you consume drugs and as you consume food, it is safe, and the customer's trust and safety, is upheld. So, these are just 5 major difference between PCN and NAFDAC. If you can't remember anything I said, remember these 2 things. The law that established both of them are different. PCN looks at the practice, looks at the profession, looks at the human resource. NAFDAC looks at the food, the product, its quality, its safety, either through manufacturing and all of that. Okay. So I think we can go to the next slides. If anyone has any questions, please feel free to raise your hand. So let's go to the next slide. The technician's role, right? By the time we're done with all of these classes, you go for your internship, you will have hands-on, experiencing. I hope you do have actual hands-on experience with on the dispensing process. But in the 6 months, I think, of your IT, right, you will have to come across 1 or 2 or all of these roles. You will have to act in this capacity. You will have to interpret and prepare preparations. There's no 2 ways about it, right? As long as you're in the pharmacy, either in the hospital or in the pharmacy outlet, right? You will have to receive prescriptions. You will have to go through the steps. You will have to interpret the prescriptions. Okay, so what does this one mean now? Is paracetamol, and why are they saying 250 for this child, for this 4-year-old? Is it not too much? Shouldn't it be 125? You have to be able to interpret the prescriptions. You will apply your learnings on correct labeling. Remember, we said after the prescription, once you've packaged the drug, you will have to label it appropriately. I know you will. You will have to write the name. You have to write the name of the patient, the generic name of the drug, the strength of the drug, how it should be administered. You will, interface with labeling of packaged drugs as a pharmacist technician. You can't avoid that. Register, documentation, it's a must. There are instances where if you have a pharmacist, in available, They could do all of the preparation, labeling, actual dispensing. But in a lot of cases, the documentation is passed on to the pharmacist technician. You will have to learn to record appropriately using the right registers, right? You will support the pharmacist in counseling, especially during rush hours or peak hours when there are so many people, and if the hands the manpower within the pharmacy is not adequate, you would have to step in and do other things, including counseling and providing patient support. And of utmost importance, as a technician, you're bound to uphold the ethics, the standard, and the professionalism that comes with the pharmacy practice. That is a must, right? And so, I really look forward to hearing, your experiences, if chance permits, as you interact on the field with actual patients, and how you experience dispensing process. So we go to the next slide that looks at common errors. Again, I told you, imagine if, with Japa that is everywhere now, workforce, the health workforce has significantly reduced within our hospitals, or, health care service provision generally. And so you're in a hospital, maybe there's only one pharmacy or non-pharmacy, just you have 50, 70 patients. It's a lot of work. And because in most of our hospitals, our automation, like using digital, we're not yet as digitalized as we should be, even within this century. And so there are bound to be errors. There are bound to be errors. And, most common errors, is simple: wrong medicine. Simple, wrong medicine. This one looks, they look alike, and so, if you don't check, if you assume, I heard in compounding, you should not use your eye to measure, Abby. If you assume, if you look your eye to measure, you could administer the wrong drug. Some of them could have similar colors, they could have similar shapes. They could even sound alike, erythromycin, azithromycin. There's sha-amycin on the name, Abby. So if you're not careful, you could dispense the wrong medicine, and that could be risky or even fatal, in some instances. So that is one common error. Another error is wrong strength or dose. Hmm? Antibiotics, for instance, an adult dose cannot be the same, with a pediatric dose. And so, in the heat of work, if you're not careful, you could issue the wrong strength. You could, ask that the patient takes it more than they should. Again, that is common errors that we find, within the dispensing process. Wrong labeling. When you have you have 1, 2, 3 different prescriptions on the table. You're in a hurry. You're not arranging them well. Before you know it, you've carried this person's drug, and given this patient, you've labeled it wrongly. Is paracetamol on it? You say is you say some. Okay, let me use yellow, right? It's Flagyl. You now write is ACT. Artemisinin combination therapy, and boom, you're supposed to be treating for an infection, you're treating for malaria. So, these are, you know, common errors that comes with wrong labeling, these are the wrong patients. And then lastly, when you omit an instruction, you can imagine, in the heat of work, you give somebody drug, you don't tell them, how they should take it. Is it, how for how long, duration and all of that, and they go home and they're left to interpretation. So these are big more errors. And if you've practiced two of these errors, you over time, because these strategies have been put in place on how. And so one of the easiest strategy, please next slide, are written stepwise actions that one needs to follow consistently in order to do anything. Please next slide. you know for receipt of prescription, for example, there'll be an SOP that says collect. I'm just saying an example. Collect prescription, greet patient, ask for name, right? It looks like it's very, micro level, step by step, the next action that needs to happen. And so as a technician, if you're in doubt of any of the process or the standards that are required, it's always safe to go to your SOP. There's no shame in it. Open your SOP, just open and keep, and literally be following every step. If you follow each step consistently, you're likely, more than not, to avoid errors or mistakes, right? So, those SOPs are found in literally every hospital, pharmacy, or even in the private sectors. You find them there. Then it is imperative, it's important. Don't assume, always double check. Always double check on every stage. Once you've put together, you've packaged your drug before you give. In some instances, it's even mandatory that once as you've packaged and you've labeled, you pass it on to someone to check. Like it's a mandatory step in some instance, just to double check and ensure that the right patient is getting the right drug, and all of that. So that's another strategy, that has been used. Then, of course, technology. With technology, the risk for errors is greatly minimized. In some settings, you have what we call electronic prescriptions, digitalization, even in counting of drugs. Other places, with AI, advancements generally, help to minimize errors as much as possible. Hopefully, Nigerian hospitals, maybe in the nearest future, will all get to get to that point where technology is being used as it should within the dispensing process. And then lastly, because we are human beings, if we learn to just focus on what we are doing, mm, avoid distractions. You're trying to dispense drug, you're just saying, Tinubu will not kill us, or you're Manchester United. I mean, you just distractions, right? With distractions, there are possibilities of making errors. And so it's important that as you're dispensing, you're focused, attention is on the job, and just being diligent in doing what you're doing. You will, all things being equal, minimize errors. Okay. So those are a few things that if you do, you will likely go through the process smoothly. This takes us to the very last slide for this course. And basically, please, the last slide, next slide. And basically, this is just to, again, summarize all the and dispensing process. Please, last slide, sir. Next slide. Thank you. Again, Remember, dispensing is a process. It's a technical process. It is structured. It has to be legally regulated because there is a law. There are laws that govern the practice of pharmacy, and pharmaceuticals, and dispensing is one of the practices of the profession, right? Out there, as you dispense, know that your way is not trivial. It's important what you do. It's important, dispensing as a practice. Please note that as a pharmacist technician, I keep saying in most cases, except for when a patient is admitted, you're likely going to be the last person to see a patient. And so it is very, very vital that you think about the patient's safety, even as you engage with the patient. You counsel them, you talk to them, you explain to them the drug, what is being used for, how long it should be, if they take the drug, if they have any feelings that they're not comfortable with, they should come back, and all of that, is vital that you prioritize the patient's safety. And so safety is applied, right? It's passive, it's also applied. And so by giving the right drug to the right patient, you're securing the patient's safety, right? And so please and please, it's important that as technicians, we are focused on to the practice. Again, know that every step matters, right from collecting the prescription, like right for interpreting, running a clinical check, how you prepare, how you label, as far back as down the line to even recording. Every step in the dispensing process matters. It does matter. Then lastly, even though there are global differences, exist, but the principles behind dispensing are universal. Principles in the sense that, like we've mentioned, there has to be a valid prescription. Confidentiality should not be compromised. You must learn how to keep records, and lastly, adhere to the framework that guides the practice. So yeah, that is it. I think that is the end of my slides and models. I'm happy to take questions, you know experience sharing, or anything that strikes you during the course of this class. Please feel free to share. Thank you.
Thank you, ma'am.
Thank you, Aris. Do you have any question? Do you have any experience you would like to share? Anyone? Okay. None?
Hello.
Going? Yes,
Oh,
yes, Stephanie.
well, I just wanted to say thank you. You made learning easy because it's as explicit as possible. And I enjoyed every bit of the class. Although I wasn't in the last lecture, the first and
Mhm.
this lecture is really refreshing. Thank you, Doc.
Thank you. Thank you for the feedback. Thank you. I hope you write exams. So I have to ask. I'm not sure if there will be exams, but if nobody asks me questions, you're not allowed to fail any question on dispensing, if exam comes. So it's been a wonderful experience, with all of you. If there are no questions, I'll allow everyone rest. It's a Sunday evening. We have a whole week ahead of us. Yeah. Stay blessed. Take care, everyone.
Thank you.
Bye.
Thank you.
Thank
Bye.
you,
Thank you,
man.
ma'am.
Bye.
Have a good night.
Bye.
Thank you
All
very
right, good
Have a
night.
good
much.
night.